Hey, my name is Dr. Avi. In this video, I'm going to share with you a story about an associateship that I had about a year and a half after I graduated dental school. I feel like when I can share my experiences with you, you really get a good idea of what it's like to be a dental associate. Hopefully, you take something away from this video that helps you in your career. So, you're watching part 7 of this series. If you haven't seen parts 1 through 6, go back and watch those and then come right back here. So, if you watched part 6, you know that I got fired over text. Yes, the owner dentist sent me a text and fired me. This was by far the worst breakup text I have ever received. Okay, so to give some perspective on my situation, before I got fired over text, I was working at that office 2 days a week and 2 Saturdays a month. Earlier that year, I had left a Medicaid job and I was looking for a private practice. This video is going to be about that experience. So, like many of my associateships, I was still looking for a mentor and just a space where I could learn how to be a better dentist. I knew my shortcomings. I knew that I wasn't the perfect associate. I'd only had about a year and a half of experience. I really did know that there was so much to learn, and I was looking for a place to help foster that. I found a place that was about 5 minutes from my apartment and had a really good online presence. I applied on Indeed and I got an interview with the owner. I went in, and just like most interviews, the owner asked me, what am I looking for in the practice? I told her, hey, I'm pretty confident in my skills, but I'm looking to improve and grow as a dentist. She told me that they had plenty of patients and that I should be able to get busy in no time. She told me that she owned multiple practices and she shared with me the vision for the brand that she was building. She said that she wanted to make her practices kind of be like a dental spa. I really liked the sound of that. She emphasized that all of that starts with patient experience. The office was clean and new. They even had an iTero scanner, and she told me that I had free reign to do whatever procedures that I felt like I needed to do. She also told me that they had a periodontist that would come in a couple times a month and do surgeries on those days. And those days, I would be required to also come to work, but I wouldn't be allowed to actually practice. I was more going to like facilitate the patient with their implant experience. I found this to be kind of odd. I really just didn't see the point in me being there if I wasn't working. Her reasoning was that this was a good way to improve patient experience. To this day, I still don't see the point of me being there. I wasn't being compensated for that day and I wasn't allowed to practice. They called it a surgery day. So yeah, I'm still trying to wrap my head around that, as you can tell. We started to talk about pay structure and she said that she wasn't going to offer me a daily guarantee. This was a big red flag for me. Because in my experience, if I know there's no daily guarantee, then I know that the owner is not going to be incentivized to fill my schedule and help support me. And I know that it takes a couple months for a new associate to really get going into practice. She ended up offering me the job and I politely declined. A couple weeks go by and then she reached back out to me. She said that she believes I'd be a great fit for the office and she wanted to know why I didn't accept the job offer. I told her honestly, the fact that she wasn't willing to give me a base guarantee really didn't sit well with me. I needed some stability in my life from a financial perspective, and dedicating a couple days a week to work in a practice, I needed to know that I was having some type of income, even if there weren't patients coming in, because I have student loans and bills to pay. She understood where I was coming from, and then she decided to offer me a base guarantee of $500. We agreed that I would work 2 days a week, Mondays and Wednesdays from 8 to 5. I was super excited to start at this practice. Like the fact that this owner was trying to build out like a dental spa really got me excited because I wanted to be a part of something that was cool and new. This was also my official transition away from a Medicaid office. So this was friggin' sweet. It was kind of like a boutique practice. And the last time that I was in such an intimate setting was my first job out of school. Now I had more experience and I was looking to take everything to the next level. When I started out, the owner was there with me. She was answering questions, giving me mentorship, really helping me along. I didn't mind this. I actually really liked it because it helped me acclimate into the practice. After about 2 weeks, though, she stopped coming in and she added me to a group chat. And in the chat was me, her, and another longtime associate. That associate was kind of like the clinical lead, and she worked in another practice and on alternating days with me, the current practice. The group chat was used basically to discuss overlaps in patients and cases and stuff like that. So the office, the vibes, they were okay. The music was, however, getting very old after a while. It was like 2000s pop playlist, and it's a great era and great genre of music, but hearing that for 8 hours a day, every day, is very mind numbing. Patient flow. So the patient flow was really good. I was doing a bunch of exams and I was really just trying to build rapport with them. I was diagnosing a lot of treatment, but not so much was ending up on my schedule. This was kind of weird. I monitored the schedule to see if anybody was poaching my patients, but nobody was. They just weren't scheduling. I wondered why this was happening, so I turned to the owner and I asked for some advice. She met with me and told me that I needed to place more emphasis and urgency on the treatment that I was diagnosing. She told me that the manager told her that I was being very casual about the treatment that I was diagnosing to patients, and so the patients didn't feel like they needed to schedule right away. Honestly, this was super valuable feedback for me. I took the advice and I tried to alter my delivery when treatment planning and presenting cases to patients. Some more days go by, and then the manager starts just giving me like unsolicited feedback. Now, I'm not against learning from team members, but my issue was in that how she was giving me the feedback. She was talking to me in a tone of like knowing more than me. Honestly, she probably did. I didn't really mind that. What bothered me was that she was directly comparing me to the other associate. She would say things like the other associate doesn't have any problems diagnosing treatment. Everybody schedules with them. She didn't just say this like one time as, some feedback. She said this every day for like 2 weeks. Like, I get it. I'm trying to do better. But this other associate has been in this practice for several years and has rapport with these patients. Patients trust them. Patients don't know who I am. I just started there. This was something that the manager clearly didn't take into account. The next red flag that came up for me was that group chat that I was telling you about. The associate doctor used it to question treatment that I was diagnosing. They also used it as a platform to critique my work and tell me what I was doing wrong all the time. I'm sure they had good intentions, but this form of communication was not productive. All I was reading was negative feedback, and it really started to just wear away at my confidence. How would you feel if you ran a group chat where all they did was just shit on you for everything that you do? Not too cool, right? At this point, it was very clear that I was not going to fit in. I started looking for another job. I put in my notice and I left. So let's assess this entire experience. It was never actually good, like at all. The best part was that it was 5 minutes away from my apartment. I did basic dentistry here with a sporadic, inconsistent schedule. I didn't really have autonomy because I was just being micromanaged by the other doctor. My confidence as a dentist really took a huge blow in this situation. Sure, I wasn't the best dentist. I had a lot to learn, but I sure as hell wasn't as bad as they were making me out to be. Their form of teaching just didn't mesh with my form of learning. All right, what can you do to avoid the situation? If you feel like you're being micromanaged at all, speak up. I probably could have been better about communicating and being more open about how I was feeling based off their feedback. But at that time, I just didn't feel like there was a safe space for me to really communicate how I felt. Like I said, I'm sure everybody had good intentions because they know how to operate and run that practice. They've had success in it. I wasn't having that same success, so I'm sure they got frustrated. Some patience or structure in an environment like this would have gone a long way. They clearly had a way to do things, but never took the time to teach me their ways. So if you're in a practice where there's a clear structure, you are going to thrive. When there's not structure, you either need to create it or openly work with the owner to try to figure out what is going to work best and how are you going to succeed in that practice. Another thing you can do is you can always ask for time outside of clinic hours to work with the owner to really figure out how you can be most successful in the practice. When you know how an office runs, you will be on a fast track to success there. I hope you enjoyed this video. Please drill that like and subscribe button and share this with anyone you think may benefit. If you're wondering how my next job went, a spoiler is that I tried to change the dynamic in an office and it completely changed the course of my career. Check out part 8 to find out. Thanks.